Welcome back to Consider This. Melisa, Sharaad and Ibrahim here with you. Now let's continue our in-depth look at Budget 2020. It was tabled late this afternoon. Joining us on the line now to discuss the healthcare allocation, we have Azrul Khalib, the CEO of Galen Centre for Health and Social Policy, It's a healthcare policy research and advocacy outfit. Thank you so much for joining us this evening, Azrul. Now, my first question to you, looking at the allocation for the Ministry of Health, it was allocated 30.6 billion ringgit in this budget. Now, that's a 6.7% increase compared to budget 2019. What do you make of this quantum of increase, Azrul? Is it significant enough to make a difference in the healthcare sector?
Well, honestly, when you compare it against last year's increase, this is actually lower in terms of the percentage of increase. And despite that, when you look at the proportion of which health now makes up in the federal overall government budget, it is now 10%. And this is something that I think when you look at the overall amount, which is now past the 30 billion mark, it shows a clear commitment by this government to continue on with its predecessors in terms of making sure that the healthcare budget continually enjoys an increase of at least 1 to 3 billion each year. And this year, we're fortunate to have a 6.7% increase, as you said.
Azrul, I got to focus on the two types of budgets right now. The operating expenditure budget of the healthcare system, which moved up, ever so slightly at 5%. But the significant jump is in the developmental budget or developmental expenditure budget, which increased 23.8% or 24%. Clearly, this is a big significant shift towards building, infrastructure towards the healthcare system. How do you read this particular boost or shot in the arm for the developmental budget aspect of the health ministry?
Well, I think if you look at the Malaysian infrastructure overall, it's quite aged, and it needs to keep up with the demands of a growing and aging population, one that also faces increasing number of non-communicable diseases like cancer, diabetes, hepatitis, and so forth. So the problem here is that we have a situation where we're still depending on the infrastructure that was built maybe 2 decades ago in order to meet the needs of this growing population, and we just can't do it with what we have. We actually have to invest in new infrastructure that can meet the demands of the population. And I think the government, in its commitment towards building these new hospitals and to improve on the existing infrastructure, has recognized the need to make this investment. It's not an easy one. After all, when you build new structures, it comes with maintenance costs, and maintenance costs will occur every year. This is something that the government obviously has thought very carefully about and has decided to basically make this investment.
Azrul, in terms of the kind of mix between the private and the public in providing healthcare services, do you see anything in a shift of thinking about the balance of public versus private healthcare providers?
Well, when you look at a population that still depends on the public healthcare sector in order to meet its healthcare needs, which is around 70% of the population here that actually accesses the public healthcare system. So we see still very much a need to bolster and to improve upon those services that are very much still concentrated in mainly urban areas in order to meet the population. Now, if you consider the fact that today, when you look in terms of budget sizes, you see education, which has been given a 64 billion ringgit allocation, and it covers a very small part of the population compared to this 30 billion allocation, which covers the entire population of the country. And you realize that actually you are needing to invest in the public healthcare infrastructure that is not only able to cater for those accessing public healthcare, but also to a very large extent, also people who are currently accessing private healthcare, but may at one point or another, maybe because the insurance has run out, maybe they want to have options that are available for much less in the public healthcare sector, would then move from the private healthcare to the public healthcare. So we're looking at from the very start, 70% of the population accessing public healthcare, and perhaps a few more percentages moving from private to public, which increases the load that we have on the public healthcare facilities. So obviously, we need to be able to invest in public healthcare.
Azrul, in the process of allocating these funds for the healthcare sector, now the government chose to provide free vaccination for children for pneumococcal vaccination. That is, that's costing 60 million ringgit. Now, how significant is that? Could you give us a sense of how important that is as allocation as part of the healthcare sector?
I must congratulate the government here for this commitment. This has been a long time coming. I'm sure a lot of the advocates have been working on this issue for more than a decade, are actually celebrating and crying with joy, because pneumococcal disease is a serious disease that affects young children. It can infect the brain, lungs, and blood, and it causes permanent disability and even death. And to have this commitment by the government in putting in 60 million as a preliminary allocation to invest in this pneumococcal vaccine program, I have to stress it's not about fulfilling a promise in the Pakatan manifesto. That's just a bonus, I think, for the government. It actually signals a recognition by the government that to the efforts of the vaccine advocates that investing in vaccines is far more cost-effective than treating the diseases which are vaccine preventable. And it's really about saving lives, preventing permanent disability and even death in future. So I really have to congratulate the government on actually making this bold move to invest in this vaccine. Now, when you consider the fact that the entire national immunization program today is around 126 million, to have one vaccine, which is this TCV, the pneumococcal conjugate vaccine, to take up an additional 60 million, making it around maybe 180, 190 million, is indeed a bold investment on the part of the government in protecting children, babies, infants, and young children from this disease. So that's a really good move.
Azrul, we don't have much time left. Maybe a short answer on this one. Do you think that there is enough in the budget to actually reskill, retrain, and move the value chain of the healthcare workers and healthcare providers to getting better trainings, getting better exposure following the development budget increase?
Honestly, retention of skilled manpower in the public healthcare sector, especially, is an issue that is a huge burden for the government today, because essentially what's happening today is the public sector, public taxpayers are actually subsidizing the training of doctors in the public healthcare who then become specialists. But then upon completion of their houseman, their specialist degrees, then leave the public sector and move on to the private healthcare sector, where they can earn better salaries, have more flexibility in their time, and be able to build their careers. Now, this is a problem because there is a brain drain from the public sector to the private healthcare sector, and unfortunately, to date, there has been no real solutions that have been able to address this concretely. At the end of the day, public salaries cannot compete with private salaries. So at the end of the day, you are having to appeal to doctors being committed individuals who believe in the Hippocrates Oath, who believe in serving the Rakyat, and who believe in helping people who are less able to afford private healthcare. So it's really going to be depending on people's goodwill and commitment to the cause in order for them to stay. So this is a problem that, unfortunately, with this budget, it does not begin to address, even though the emoluments still make up the majority of, I think, around 40% of the budget. It unfortunately does not address the retention of skilled specialists and doctors in the public healthcare.
Astro, thank you so much for speaking with us. That was Azrul Muhammad Khalib, CEO of Galen Centre there. Now, after this, we're going to come back and take a quick look at youth and the issue of unemployment. What's in it? What's in it for them in Budget 2020? Back in a couple of minutes. You're not youth. Back in a couple of minutes.